here to my right, we have Emily Schmidt. She's a medical student. And to my left is Dr. Supriya Paidemarry. She is a family medicine resident. So we're going to be doing a pranayama called Kapalbhati. Kapalbhati means luminous head. The meaning comes from Sanskrit, saying that this illuminates the brain, sharpens the brain, and illuminates the brain. Again, it's a stimulating pranayama. So there's always a caution that comes with stimulating pranayamas, is that this done at a slow pace is actually calming. When done at a faster pace, then it can be stimulating. So stimulating, what I mean in that it stimulates the sympathetic nervous system, at least for the short duration after doing these pranayamas. And then it also stimulates our sympathetic reaction in terms of increasing heart rate and blood pressure. One of the cautions with these stimulating pranayamas is that they can cause lightheadedness because, again, the breathing rate is variable depending upon how each person is comfortable with. We're going to always start with a slow pace. Maybe I will demonstrate very quickly some fast pace, but again, I don't want anybody to try it without proper guidance with a teacher. Kapalbhati involves normal inhalation, passive inhalation, and it involves passive inhalation and active or forceful exhalation in a quick stroke of the abdomen. Suddenly pull in the abdominal muscles and the diaphragm to expel the breath. So Kapalbhati, why do we do it? One is it's energizing. It is a stimulating pranayama. I sometimes do it when I'm feeling very tired, probably during the middle of the day. When I'm feeling tired, when I'm feeling cold. So it increases the heat in the body. It's a heating pranayama. It is also energizing pranayama. So a caution is always these, if somebody is trying to do these stimulating pranayamas, they always should end it with a calming pranayama at the end of each stimulating pranayama. Traditionally, it is thought to improve clarity of thought. It also improves quick thinking. And it also cleanses the respiratory tract. Most of these pranayamas do that. Again, pranayama, the name that comes from yoga tradition. Prana means breath, vital breath. This is what gives us the life force. When prana is there, there is life. When prana is gone, there is no life. So ayama means expansion or control. So this is both expanding the breath and also controlling the breath. Pranayamas come from yoga system, and it is a 8-limbed yoga system, and pranayamas is the 4th limb. What we know as yoga in the West, called yoga asanas, yoga poses, that is the 3rd limb. So what do the pranayamas do? They help prepare our body for the next step of meditation. They also help tone the body, tone the nervous system, and also streamline our respiratory system, clean out our respiratory passages. So we typically do a cycle of 10 strokes, and then pause of 2 minutes, and then you can repeat the cycle. So depending upon where you are in your practice, you can do anywhere between 10, a cycle of 10, or you can build it up to a cycle of 50 with 2-minute break in between each cycle. So for this, again, you're sitting erect on a chair with feet touching the ground and with your eyes either closed or open. I prefer to do it with eyes closed. That cuts out the visual stimulus, so I can focus on my breath. Again, when you're breathing out, even though it is a short stroke of breath, exhalation, your stroke is strong enough to expel all the air. It's a complete exhalation with a quick stroke of breath, quick stroke of exhalation. So I'm going to demonstrate first, and then we can do it together. So we always start the pranayamas with a normal breath in, and then the longer exhalation. And then the next breath we take tends to be a slightly deeper. So So as you have noticed, when I'm breathing out, it's a quick stroke of exhalation, but I'm making sure that I'm exhaling all the air out. If you don't do that, then it may cause lightheadedness. As you noticed, it's a passive inhalation after each exhalation. And you can take your time. If you want to take a longer breath in, you can also do a longer breath in. Or, whatever that is comfortable for you. It's normal. You're not putting any effort into breathing in process. It is only the breathing out process. You're putting effort and using your diaphragm with a quick stroke to expel the air. So, again, as I mentioned earlier, if you have low energy, if you're feeling cold, then it can be helpful. So now let's practice together for about maybe 5 to 10 breaths. And if you feel lightheaded at any time, you take a deep breath and stop. Okay, so let's begin. So normal breath in, exhale, and then the next inhale, passive. But okay, we didn't do all the 10, but we did about 8. And also I noticed that we have varying degrees. We're not totally synchronized because each of us have a different breathing rate that is native to us. And then we don't want to force anybody to synchronize with somebody else. Then it's just not as comfortable. So now, having experienced it, any questions?
How do you know if you're going too fast or what the right rate is?
So rate is what is comfortable for you. What we did is a slow pace. Slow pace is anywhere between 4 to 8 breaths per minute. The normal breath rate is anywhere between 12 to 14, as you already know. The slow rate is anywhere between 4 to 8 breaths per minute. And faster pace can go even faster. So did either of you feel lightheaded?
Not yet.
No. Okay, that's good. That's good. Yes, at a faster pace, it can cause lightheadedness. So I don't want you to do it after me. I'm just going to demonstrate what a medium pace looks like. So again, the same process. Normal inhalation and normal exhalation deeper. And then other passive inhalation. So that is the medium pace. I'm not going to demonstrate the faster pace, which is also called breath of fire. Somebody who doesn't have a lot of practice may cause lightheadedness. And this is always anything beyond medium pace should be practiced with a teacher. So now, what kind of things did you experience in terms of your body?
I felt my heart rate
go up.
pretty immediately.
Yeah. Now it's stabilized, maybe gone a little bit slower too.
Yeah.
And it was energizing. Yeah.
Energizing, yes. That's what it does. And the studies show that. I'm going to mention a few studies here. 3 cycles of 5 minutes each with 1 minute break in between. It improved working memory in healthy people. And also, there was an slight increased heart rate in the beginning, but again, afterwards, the heart rate slowed down. It also, as most pranayamas, Kapalbhati also improves heart rate variability, which is a good thing. Improving heart rate variability is good for the heart. And there are several studies that showed that effect. And one study that did it with slow pace also improved blood pressure. But that was after 20 minutes. Initially, it went up, and then 20 minutes later, blood pressure decreased, and heart rate decreased too. And then to me, it sounds like to anyone, it may sound like it is counterintuitive to try it in asthma patients, because one would be worried about triggering asthma attack with these, like you're breathing out fast. Contrary to that, one of the studies showed improved lung capacity in asthma patients. So that is, again, that was done at a slow pace. One word of caution. There was one case of spontaneous pneumothorax, which is like, it's a small opening in the lung that lets the air out without the nostrils. So that can be very painful, and it can be an emergency. So that's why one of the word of caution here is that if you're learning it, make sure you practice slow, gradually go up on the speed, and then also better practice with a teacher. Or you can use this video to practice, but again, keep it low and slow.